Hi, I'm Melissa Bantug in the Johns Hopkins Breast Cancer Survivorship Program. Today we're joined with Dr. Kimberly Peairs. She's an internal medicine doctor here at Johns Hopkins. We're going to ask her some questions about what patients need to know as they finish active treatment for cancer. Dr. Peairs, can you tell us a little bit about what you hear from patients as they come back to see you after cancer treatment?
Yes. So when patients come to see me after they've had active treatment for their cancer, there's the symptoms, physical or psychological, that they report are varied based on the individual patients, the cancer type they've had, the treatment, including surgery, chemotherapy, or radiation therapy, as well as any other medications they may still remain on related to their cancer, such as endocrine therapy that prostate cancer patients or breast cancer patients remain on. But there are some common themes that patients present with. The most common I see is fatigue, which is a ubiquitous symptom and can be multifactorial. And I think it's important as an internist to step back and take a full history and assess if there are any other non-cancer reasons patients have fatigue. And if it's really related to any one of their components of cancer treatment, discuss that with patients. And also reassure them that that may take a while before it resolves, and help them work through that and talk about behavioral activities that they can adjust to adapt to the fatigue that they experience. Other common physical symptoms I hear patients discuss, particularly for women, are hormonal changes that occur, hot flashes because of the treatment or because of the medications they're put on after their cancer, can be very life-altering. And I think it's important to discuss some behavioral modifications and even medications they could consider, as well as some of the treatment side effects of medications they're put on, such as endocrine therapies and when they experience joint aches or muscle aches. With regards to surgical side effects, patients sometimes have lingering discomfort at their surgical sites, whether it be breast surgery or abdominal surgery, and helping them to identify what is normal and what may be something out of the range of normal, because patients often have concerns that it's a recurrence of the cancer at the cancer site. And then another physical symptom, if we'll call it that, is patients feel like maybe they're not psychologically as sharp. Or this chemo brain concept, which is a very hard thing to quantify, but helping the patients work through that and kind of identify for them what's their new normal.
So I think that's a really helpful list. Can you give us some indications of some of what you hear, both emotionally or psychosocially, after a patient comes back to see you?
Sure, and those are equally important as the physical side effects that they experience. A common one is fear of recurrence. You know, if is this going to come back, and if it comes back, how is it going to come back? When oftentimes on the early stage cancers, it's highly unlikely that it's ever going to rear its ugly head again. But that's a common concern that patients have, and the further they get away from their active treatment, the less that becomes. But oftentimes it never fully goes away, and to reassure them that that's a common feeling. Patients also sometimes have difficulty transitioning back into what is their prior lives, going back to work, being treated as a non-cancer patient, and you know, when they're in the throes of cancer, that is their world, or their cancer treatment, that is their world. And then when they're not, life moves on, and that's often a difficult transition for patients. And then I also have patients report to me they have sensations of guilt. And with that, guilt for their family and their care providers that have spent a lot of time taking care of them and have had to carry the load in the patient's expectations, when oftentimes the care providers don't articulate that, but the patients feel that guilt. And to try to help them work through that.
That's been great. Can you tell me a little bit about what you need to know as a primary care doctor when a patient comes back to see you at the end of treatment? What are some of the things that are helpful for you to know about his or her treatment?
Yes. Well, I'm hopeful that they haven't completely left my practice when they're getting their active treatment, that there's been a close relationship with myself and their oncology physicians during their treatment. But what is helpful for me is to try to get a background feeling of how their cancer presented if I was not involved in that diagnosis, what kind of imaging that they had at the time of their diagnosis, tumor type, tumor staging, and what their treatment course was, including what kind of surgery they had and if they had any side effects from the surgery, if they had radiation, and if they had any side effects from the radiation, and what kind of chemotherapy they received, and if they had any problems with the chemotherapy, and if they were able to complete the course. Because all of those I need to consider when I'm thinking about the patient in the long term, and if any of those have implications for their long-term care. And then I also like to discuss with patients what the follow-up plan is when they're seeing their oncologist, whether it be a surgical oncologist or a medical oncologist or a radiation oncologist. Is there a planned interval at which they'll follow up with them, and who has arranged follow-up assessment for their cancer, and when that would be transitioned back into my purview.
So during cancer treatment, it can be a very busy time with lots of doctor's appointments and lots of other things going on. When a patient comes back to you, what are some of the things that you need to know at the end of treatment?
So I always tell my patients that I think about them as cancer patients and cancer survivor patients, and then I have to take my hat off and look at them as non-cancer patients. And by that I mean there are other health issues that we can't ignore that are as important sometimes as cancer. And that's heart health is one biggie I consider, and discussing with patients the importance of individualized assessment for their blood pressure, cholesterol screening, weight management, to making sure they're maintaining an adequate weight, and if necessary, screening for diabetes, encouraging them to maintain an active lifestyle with exercise, and healthy eating habits, which all sort of roll up into cardiovascular health. Other important things are other cancer screening that needs to be done, and not even just specifically because they have one type of cancer, but because everyone should have these. And with that, including for women, things like pap smears, or mammography if they have a non-breast cancer, non-breast cancer otherwise, colonoscopies and the appropriate screening recommendations for that, and then vaccination schedules, which I think adults forget sometimes that they actually still need to be updated on some vaccines, and so I review those with patients. And then also reminding patients when it's appropriate for things like bone density screening, particularly for breast cancer patients. Sometimes that's more relevant, and some of the men suffering from prostate cancer.
Great, this has been really helpful. Thank you so much for your time. Thank you so much for joining us. I hope this was helpful.